The science that is governed by the basic laws of nature is now helping medical science to save lives of numerous cancer patients. Hello and welcome. Here we are going to discuss how physics plays an important role in the treatment process of cancer patients. Myself, Subodip Roy, Assistant Professor, Department of Physics, Mallabhum Institute of Technology, Bishnupur, Bankura. We all know that nowadays cancer is a menace for medical science. What is cancer? Cancer is nothing but the uncontrolled growth of cells. Cancers are the growth of cells. They are mostly cancerous tumors, and as a result of this, they don't perform their intended functions. One cell is divided into many cells, and thereby it is spread throughout the body. In the treatment process of cancer, the radiation therapy is hugely used. Radiation therapy, the idea of this science comes from physics. The aim of radiation therapy. The aim of radiation therapy is to cause damage to the cancerous cells while minimizing the risk of surrounding healthy tissues. The damage of radiation to the cancerous cells just stops them to reproduce, and thereby the size of the tumor decreases time. But there is a problem. Whenever the radiation from a high energy source is used, it can also damage the healthy tissues or cells. Usage of ionizing radiation in medicine is diagnosis, treatment, and sterilization. All these includes radioactive materials, so these are to be used very carefully. Radiotherapy diagnosis. Before the treatment process, we have to diagnose a patient. For this purpose, the ionizing radiation is best suited because they are easy to detect. Here, radioactive materials are used, and those materials are called tracers. They are going to trace the cancerous cells. In nuclear medicine, a tracer is a radioactive substance which is taken into the body either as an injection or as a drink. Such a substance is normally a gamma ray emitter, and these gamma rays can be easily detected and monitored using different devices. Such a diagnosis process gives us the idea of problems in body. How much gamma emission is absorbed, that quantity denotes how much cancerous cells are present in that body. So important to be able to study internal organs or tissues without the need of surgery. In such cases, radioactive elements are used as tracers. They are injected into the body, and their absorption process and quantity of absorption can be detected using a gamma camera. This is a schematic diagram of a gamma camera where the blue lines denotes the electronic systems, red lines denotes the detector, and the white lines are collimator. The next step is to treat the patient. The treatment of a cancer patient using radiotherapy consists of three phases. One is planning, second is simulation, and third one is the treatment itself. The cancerous tumor has to be first located so that its size and position can be analyzed. This information can be obtained using different tools from physics. One is X-ray, next is CT scan, third one is MRI scan, and last one can be the ultrasound images. Using these tools, we are getting the exact location and size of the tumor, and Depending on that, the dosage of the radioactive materials is now calculated properly. The second phase is simulation. Once the amount of radiation to be given has been accurately calculated, the patient then goes to the simulator to determine what settings are to be selected for the actual treatment using a device named linear accelerator. Linear accelerators are the devices in which different high energy particles can be produced, and those high energy particles can be used to emit X-rays that are now going to be used for cancer treatment. So the settings are to be determined taking a series of X-rays to make sure that the tumor is in the correct position and it is ready to receive the ionizing radiation. The third phase is the treatment. Cancerous tumors can be treated using radiotherapy as follows. First one is by using high energetic gamma rays, and the second one may be using high energetic X-rays. Energy gamma ray, then a radioactive element known as cobalt-60 is used. The cobalt source is kept within a thick heavy metal container, and that container has a slit in it to allow a narrow beam of gamma rays to emerge. The second may be the irradiation using high energy X-rays. Here X-rays are generated using a linear accelerator which is called as LINAC. These LINAC fires high energy electrons to a metal, and as a result X-rays are produced. Then these X-rays are shaped into a narrow beam by a movable metal shutters. The last is the radiotherapy sterilization. Radiation not only kills the cells, but it also kills germs and bacteria. Nowadays, medical instruments like syringes are pre-packed and then radiated using intense gamma ray sources. This kills any germs or bacteria that are present on the surface of the syringe but does not damage the syringe or nor make it radioactive. So this was a very brief discussion on how physics is helping to cure cancer patients. Thank you very much.